Wanted to use this opportunity to talk to you a little bit about the new stroke guidelines and how they affect us pre-hospitally. It should be no surprise to most of you that recent changes in the stroke guidelines make patients that have had stroke-like symptoms for less than 24 hours a candidate for having potential mechanical thrombectomy at the centers that do that. What that means for us pre-hospitally is that patients that have had stroke-like symptoms for less than 24 hours are potentially going to be considered stroke alert patients. And what that means is that those patients are going to have a high likelihood of having, in addition to the regular CT of the head that we have historically performed, will also require a CT angiogram of the head to look for any blood clot blocking one of the major arteries. And that is a CAT scan that requires IV contrast through an 18-gauge needle above the wrist. What this means is that for patients that have stroke-like symptoms with less than 24 hours duration of symptoms, the biggest help that you can provide to both the nursing staff as well as to the patient to facilitate rapid workup will be to establish an 18-gauge needle or bigger IV above the level of the wrist to allow for CT angiogram to be performed. That is probably the first of many updates involving stroke care. This is going to be an evolving process over the next probably few years. But I think for now, probably the take home is that if you have a stroke-like or a patient with stroke-like symptoms that has had symptoms for less than 24 hours, I ask that you do your best to obtain IV access with an 18-gauge needle above the wrist. Thank you very much, and we'll see you at a later date.